you have a short amount of time with these patients. You're the physician, I'm the patient. Explain to me, I need to walk.
I say to the patient, there is data out there that shows that in a patient who is a claudicant, which is just a fancy Latin way of saying it hurts when I walk, if we go in there and we intervene on you, you fall into a different bucket. And we know from a lot of data that patients who get unnecessary interventions for something that they could have dealt with by just walking have a higher rate of bad outcomes, including amputation. So what's our job here? We want to keep your legs virgin territory. We do not want to get in there and start rotoring and sticking stents in there and balloons in there if we don't have to. That would be crazy. It's like taking a person who's perfectly well-shaped and doing liposuction on them unnecessarily. Someday when they may actually want it or need it, you've now created all this scar and caused all this trouble that procedure may not go as well as you want it to. It's a silly example, but that's the way I say it to people. People get it. Yeah, okay, I get it. It's an unnecessary procedure at this point. Then I tell them, you can take care of this problem by yourself. And not only that, if you take care of this problem, you do the walking program and you create those collaterals, guess what? Those guys are with you for life. If I go in there and I rotor through something and I balloon it open, you're going to get maybe a year, maybe 2 years out of it. And then I'm going to have to come back and then come back again for another touch-up and another touch-up. But if you build those collaterals, you've now built things that are going to allow you to get that blood flow forever. And the vascular system is all connected. So you're also going to be benefiting your heart and your carotid arteries that deal with the stroke risk side of things. So overall, your chance of death from heart attack, from stroke, and the pain in your legs, we can make vanish by you doing this walking program. So now they're interested. Now I got them on the line. Then I say, it's easy. This is what you need to do for me. I need you to go home, and for the next 5 days, every day, I want 30 minutes of walking. And they say, what, 30 minutes? I can't even do 2 minutes without the pain. I say, I know. I'm not telling you to do 2 minutes. What I'm telling you to do is, over the course of 30 minutes, I want you to start walking. When you feel the pain, I want you to keep walking. And then I only want you to stop when you have tears in your eyes from the pain. And they laugh. And I say, but you get what I mean, right? And they get it. And then I say, then I want you to only rest for as long as you need to start up again. So I don't care in 30 minutes if you start and stop 500 times or if you walk a full 30 minutes. I just want you to do 30 minutes where you've really pushed yourself. And I want you to document, this is the key, how long you walk before the pain starts, how far you can walk once you have the pain, and then how long you need to rest before you get up and walk again. And if you document this, what you will find is patients will get really excited because within the first week, they'll already start to see their times increase. Oh, it's taking longer for the pain to set in. Oh, that means it's working. And then they get motivated. The same way you'd step on a scale if you were trying to lose weight and you saw you lost 5 pounds from eating salads. Wow, you're going to do another week of it. And that's what I tell my patients. And then I tell them, very rarely in medicine, very rarely, can I give you a guarantee on anything. But on this thing, I can guarantee you, if you don't smoke, okay, if you take your aspirin and your statin, and if you do this walking program the way I just described it to you, I guarantee you results. Why? Because multiple randomized controlled trials, which are the most powerful data trials that you can do, have come out that have clearly showed that for intermittent claudicants, again, which is people who have pain when they walk, if they do a supervised exercise therapy program, which is what this is called, a SET program, they do get a longer period of time where they walk before the pain sets in. Are you going to run the Olympics? Probably not, but you don't need to. What I try to tell them is, what I'm trying to do for you is I want to get to the point in your life when you get to go outside to the movies with your grandkids, whatever you want to do, and your legs are not on your mind. If that's the case, we've won. And that's what I'm trying to do. And they love it, and they go for it.